The other day, I was hiking with some girlfriends, and we had our kids. Everybody's running around. It's not a very long hike, but it was long enough that at some point, one of us had to use the restroom, and that brought up the topic of weak bladders. Like, oh gosh, we went to the restroom down the bottom of the base of the trail. We're only like a mile up, and I'm already trying to find a tree. What the heck is wrong with me? We're all laughing. And next thing we're sharing our weak bladder stories. I'm finding out that, I mean, some of these women can't jump on trampolines. They can't sneeze. They can't cough without having some sort of, possible fluid come out. And it's embarrassing. It's embarrassing, and we don't like it. And, we've all had kids. It's a very common one. And then there's me. I'm the different one, even though I've had kids that were all C-sections, so I can't blame the C-sections on my bladder issues. My bladder issues have been what I've had since I was a child, and it just seems to have gotten worse as I've gotten older. But I have this other one where I'm perfectly fine, and then all of a sudden I have to go really, really bad. And I race to the restroom, and sometimes I have a full bladder, and that makes sense, but it's kind of odd that it didn't build up. It was just kind of like all of a sudden I just had to go. But the where it's frustrating, this is the complaint, is so oftentimes I'll run to the restroom and it's like half a cup of fluid, and I don't understand why all of a sudden I would have to go so bad when I didn't even have a full bladder. So learning a lot, other women have this too, that there's really these two kind of common bladder incontinence issues. And I know you'll talk more about that later on what those two are called and how that works, but it's an issue. It's a common issue. And now we're learning about this treatment that you have at your office and a lot of other doctors are as well, called Emsella. I've got a ton of questions for anybody who's interested in wanting to know more about it for bladder incontinence, and we're here to go through them. So, Dr. Jake, can you first explain to us listeners here, some of which are men too, because I know I was just talking with my father-in-law the other day, and he's got bladder issues as well as he's gotten older. He's 65. Common issue that can happen, I think, at that age group. What is exactly Emsella, and how does it actually work for bladder incontinence?
Yeah, so Emsella is a chair that uses high FEM technology, which is a magnetic field that oscillates and causes electrical impulses in a muscle. And Emsella sends these electrical magnetic frequency impulses up into the pelvic floor muscles. So it's great on healing, regenerating, building this pelvic floor muscle, which helps with bladder incontinence and also erectile dysfunction, because the main cause of these diseases is weakening of those pelvic floor muscles. So yeah, very simple chair that sends electrical impulse. It might sound crazy, it's painful or whatever, but it's a really gentle impulse. You feel a little bit of tingling and then a little bit of a contraction and then a stronger contraction. And when you think of, oh, it's going to be like childbirth. No, it's nothing like childbirth. It's just this little gentle contraction. It feels just like you do in your own Kegel, but you're not doing it mentally. You're just, the impulses are happening without you even thinking about it. And you're getting 20,000 Kegels in just one session of 28 minutes, which is
And
crazy. And it's really building the muscle better than you ever could doing Kegels alone.
totally, oh my gosh, that many. Okay, so my next question would be, okay, so Kegels is an incredible tool to be able to help strengthen the bladder. How effective is Emsella? I just shared my two stories, right? There's some women that have the bladder incontinence issues, and men, just because they're weakening of their bladder, and now they try to sneeze or they cough or jump on a trampoline and they can have accidents. Or there's people like me, where it's more of like all of a sudden just a really strong urge and not necessarily a full bladder. How effective is Emsella for those two types of bladder incontinence issues?
Yeah, Emsella is very successful, 95% success rate in stress incontinence and urge incontinence. So stress incontinence is the sneeze, the running, jumping on the trampoline. That's stress incontinence, very good for that. That's caused by weakening of the pelvic floor muscles, but also urge incontinence. So you're just sitting there eating dinner or watching a movie and then, oh crap, I have to go to the bathroom. That's urge incontinence, and this is related to weakening the pelvic floor muscles too, and also decreased nerve signaling in that area. So if we strengthen those pelvic floor muscles, we decrease that urge of feeling like you're going to pee your pants. You're going to be able to control your muscles as you used to back in the day.
So, what percentage of men and women actually experience significant improvement from the Emsella treatment?
Yeah, so 95% of patients in the research that has been done show improvement. In my office, I'm seeing more like a 99% success rate.
So then for the ones who aren't, what's the issue with that? Have you figured, has there been a common denominator for the ones who don't find success with that, that 2%, 2 to 5% that don't find success with the treatment?
It's just how it is. Every body's a little bit different. For some reason, one body might not respond like another. Vast majority of people are going to respond well, but for some reason, sometimes people don't respond for some reason, and their muscles aren't able to get the strengthening like they should to be able to get the help they need. Or maybe in these very, very rare instances, it might not be related to the pelvic floor muscles. It's something else. It's more neurological, and that could be a reason there. I know in my patient demographic, and this is very effective for prostatectomy, the patient that I saw that didn't get great results was a patient that had a prostatectomy. But he did get some results, just not as good as all my other patients. He was able to get some more control. He just wanted to get better results in the end.
When you say prostatectomy, I'm assuming a prostate was removed for
Yeah,
prostate cancer?
yeah, it was
Okay.
a prostate removed for prostate cancer. Yeah.
Okay. And so obviously that's another pelvic issue that was going on that kind of affected it. Does Emsella help with other pelvic issues like a prolapse or a sexual function, those types of things?
Yeah, Emsella helps with all sorts of pelvic floor issues. Yeah, rectal prolapse, vaginal prolapse, bladder prolapse. This is all related to weakening of the pelvic floor muscles and also ligaments around there. So we're able to strengthen those pelvic floor muscles through Emsella. So a lot of people are getting invasive surgeries and putting mesh in their bodies to help support this, but really what you need to do is just strengthen that hammock. What they're doing is putting mesh in there as a surgeon. They're just giving you another hammock, right? But wouldn't you want to have your own hammock strengthened and not have to have metal in there? And then you are going to be scanning on the airplane all the time, and then you might have a sensitivity to it, and then you might have to get it removed later on or whatever. There's all kinds of complications that come along with these meshes. Anyone listening to this that has a mesh knows what I'm talking about. So yeah, this can really help with that, the prolapse or erectile dysfunction. Very effective for that, increasing blood flow, circulation, and strengthening the muscles there to help with erectile dysfunction.
So I haven't obviously had a mesh because I haven't brought that one up as an issue. I haven't had a prostate removed or anything like that. But I have done Kegels, and they're okay. I sit there like 30 minutes or so. I don't know how many I can get in. Maybe if I really focus, a few a minute. How does Emsella? You had mentioned, I think you said 12,000 Kegels in one session. How does Emsella compare then to doing pelvic floor therapy or Kegel exercises?
So pelvic floor therapy or Kegel exercises, I would say are old school treatments. It's what the only thing we had, and we were seeing some good results. But it takes a very, very long time. In my experience, some women get a little bit of improvement, not great improvement doing Kegels. I've been recommending Kegels for a very long time for all these issues that we just talked about. But the Emsella is so much better. So let's talk about why. So when you do a Kegel, it's your body, you're mentally sending a signal down to your bladder to cause a contraction. You're thinking about the contraction, you're causing it. And that's recruiting a couple muscle fibers to do that. And your body can't do a full contraction. It can't take it fully to fatigue because your nervous system doesn't let you do that because it doesn't want to totally fatigue the muscle. But with Emsella, using magnetic fields that are constantly oscillating, a sensory electrical impulse, but we're able to get electrical impulses to stimulate every fiber in the muscle that's contracting at the same time. And we're able to recruit all of those. So we're able to get much stronger contraction called the supramaximal contraction. So we're able to get much more efficiency for every contraction that is done. So like a 28 session in Emsella, you're getting 20,000 kind of Kegels is what they're talking about. But it's like not even that. It's like 20,000 Kegels, but you're getting super maximal contraction. So you're getting all the fibers to totally contract and fatigue. And when we get that fatiguing and all the muscle fibers fatiguing, that's where hypertrophy happens. That is where the muscle starts to grow, the muscle fibers grow, the myofibrils in there grow, and we're able to have a much more toned muscle, which you're not going to get the same results with the Kegel. You're going to get a little bit of that result, a little bit of muscle fibers are being stimulated. And also, you're not able to do 20,000 Kegels. Like anyone done 20,000 Kegels in a lifetime? Probably not, maybe a few. But you only do, and that's in one session. We're recommending 6 to 8 sessions. So obviously, you're going to get such a much better result with doing Emsella.
Okay, so I mean, it definitely makes so much more sense that this is better than any Kegel that I could ever do. What about cost effectiveness? Cost effectiveness. I mean, obviously, there's other solutions that are out there. There's surgery. There's medication. How does this compare cost effectiveness with medication and surgeries and other types of ways that people can get around the whole issue, bladder issue?
Yeah, so Emsella is very cost effective. I'm giving a trial session for $49, so you could actually see what it is, feel what it is, and see how convenient it is, and see the results that you get from even just one session. But then it's $200 per session for about 6 to 8 sessions. So total is $1,200 to $1,600 for this therapy. Surgery is going to be at least 5,000 or more for that, and then it's extremely invasive, right? Or you could take medication, which really isn't as successful as Emsella, but you can take medication. But you're going to be doing about $50 to $100 per month with that. So that's going to add up, right? And it's not really treating the cause of what's really going on either. So it's extremely cost effective. It treats the real cause and it actually lasts. You only need to do some maintenance treatments every like 2 to 3 months to keep the muscle toned and strong and treat your urinary incontinence, stress incontinence, urge incontinence, your sexual dysfunction, etc. I think it's a well worth it.
Well, I mean, I'm even thinking about my age now at 45, and I plan on living to my grandma's age, which she made it till about 95, and that's a long time. That's a long time of taking medication. It's a long time of doing, you know, somewhat effective Kegels. A long time of buying diapers, which I do not ever want to get to a place of doing that. To me, yeah, this seems definitely like a no-brainer when it comes to an investment into myself and an investment into my future and the lifestyle that I want to have as I age. What about safety? I know there's a lot of people, you know, who want to make sure that it's safe, that there's no other issues. Has it been studied by the FDA? Has it been approved? And for what conditions?
Yeah, so Emsella is FDA approved for urinary incontinence. It's an off-label treatment for erectile dysfunction, like most things are, but it's extremely effective for erectile dysfunction also. But it's FDA approved for urinary incontinence, and it's very safe. The only people that can't do it are people that have gotten that mesh already. So we're not going to be able to strengthen the bladder because it does cause some heat from this magnetic fields that are caused. So just like an MRI, so if you can't do an MRI, you can't do an Emsella machine, even though it's a completely different technology than MRI. It's just similar fields that are happening there. And then you just don't want to be wearing metal or have a pacemaker or these type of things. We'll be talking to the patient before they get it to make sure it's extremely safe before they get it. But vast majority of people, at least 99% of people, are going to be able to do it without any harm whatsoever. The only thing you notice is some soreness maybe in the pelvic area. In my experience, I've done it myself. I don't experience that. And none of my patients have even talked about that, but that is in the research that there's maybe some soreness in there, like it just like you worked out your muscles. There could be a little bit of redness there in that area for a couple hours, but really very gentle technique, really very few to no side effects with it.
Now, you had mentioned earlier that the Kegels that it does, well, I mean, it simulates kind of like a Kegel, right? That it can exercise your muscles to the point of fatigue. Now, I know when I go to the gym and I exercise my legs to the point of fatigue, I walk away and I've got jelly legs. I got jelly legs for the next couple of days. Is that a side effect as well that we could be prepared for? You're going to get like jelly bladder, where maybe your bladder is a little weaker when you get done because it's so fatigued. How does that work?
That is in the research that that is a possible concern, and they do say that, and to inform the patient that there is that possibility that there could be a little bit of weakness for a day after doing the technique. But I've talked to other people doing this and myself, and I haven't seen anyone have an issue, but there's a possible issue. So it's not going to be like jelly legs all the time. You're still going to have strength of your bladder just like you were before, right after the first session, in my experience. But there is that small possibility.
Okay. So then also you had mentioned for, it's effective for 95% of people with bladder incontinence. In your office, you've seen almost 98%. For that small percentage of people that it doesn't work for, can it worsen their condition if it doesn't actually work for them?
No, Emsella is not going to worsen the condition at all. It's either going to help or not, because it's just like exercise. It's either going to do what you want it to do or not. So if exercise is bad for you, maybe Emsella is not bad. Is bad for you. Actually, that's not really true, because people with cardiovascular disease can do it, and maybe if you're doing aerobic exercise or whatever, you can't do it. So, but it's very safe. It's not going to harm you at all. It's either going to work or not. You're not going
Okay.
to leave the issues at all.
So my next question would be, imagining coming in and sitting down on the Emsella, which is like this really large seat. You've got your clothes on, the whole bit. What is the treatment sensation feel like for the person? Is it painful? Is it uncomfortable? What is that? What are they going to experience while sitting on the device?
Yeah. So what you experience when you're sitting on the device, and first of all, like Teresa said, you're fully clothed. You're sitting on a chair, so it's very comfortable. I mean, it's not like sitting on a cushy chair, but it's comfortable. And it sends a little bit of a little tingling that you feel at the very beginning, and then you feel a little bit of a more of an impulse happening into the muscle, and then it starts getting stronger and stronger and stronger, and it never gets to the point of actually being painful at all. So it feels like contracting a muscle. Even though we're talking about that it's a super maximal contraction, that might make you think, oh no, it's extremely painful, it's like a childbirth, or a cramp. It's not like that at all. It is a gentle contraction. It sends a contraction and a super maximal contraction, but it just feels like, if you've ever done a Kegel, it feels like that. Nothing crazy, nothing really painful. It's very comfortable.
Yeah, I actually got a chance to come into Dr. Jake's office and try the Emsella, and I would definitely concur. When I was sitting on there, I mean, we started off on a lower setting, and just she wanted to make sure that I was comfortable. And then she slowly turned it up and just make sure that I could handle that. And it was like, okay, this is where we're at. And there's some goal settings like, hey, if we can get you to this one, this one's even better. And you get to decide, hey, this is my comfort spot. I can handle this. And then ideally, you can come in and like, you're getting stronger, right? You can put on more weights at the gym, right? So you can do the same thing with this, where you can make it stronger. And so I think I was at like a level, I think it was like an 80. I don't know if that was the correct number. Dr. Jake,
Mm-hmm.
correct me if I'm wrong. That felt
Uh-huh.
comfortable for me. And it was slightly, definitely tingly. Definitely, I could feel my muscle contracting. And it might have been like a really strong contraction that I could feel, but nothing to the point where I was like bracing myself, nothing to the point that was leading me to tears in any way. I could still very much be able to read a book or even have a conversation if I had a friend in there with me to be able to talk with them during that whole process. And you can kind of feel them building up. So you let it, you can feel it release, and then you feel the sensation get stronger. And it's also, I noticed that there was almost different patterns of contraction that it would
Mm-hmm.
do. Like sometimes it would maybe like thump, and then other times it would do like a squeeze, and then other times it would do something different. It was almost like it was exercising different parts of the muscle in different ways through various, I don't know what it is. What is it, Dr. Jake? What is it sending to
So it's
make?
fun. So you're Yeah, so it sends a lot of different signals there, because your muscle will get used to it, and your muscle will just get used to it and it won't build as much muscle. So it sends different signals to hit different fibers, and so your body doesn't get used to it. And also that thumping is actually releasing lactic acid. So that's why you don't get a lot of soreness after doing the treatment, like working out at the gym, for example, is because you're building up a lot of lactic acid, and that leads to the soreness. So the thumping that you feel is actually eliminating the lactic acid in the muscle.
Interesting, interesting. Okay, so when people come in, you had mentioned that they can stay fully clothed. Are there ever situations in which they would not need to where they would have to undress So that way, anybody who's coming in, they're definitely prepared. They don't wear the wrong thing. I know I did. I wore the wrong thing. So that way, I can enjoy the experience, as comfortably as possible.
Yeah, so the only reason why you would need to unclothe is that you just wore something with metal on it. And many times it's okay. We just kind of fold in the the zipper and the button a little bit, and you don't have to do that. But if you come in clothes that don't have any metal on them at all, like sweats or Lululemon or leggings or whatever, something very comfortable, there's no reason that you would ever have to do that, and you just wear your clothes and it's very comfortable.
All right. So the next question, this might be a little bit of review, but I want to make sure and really reiterate for anybody who's thinking about it. How long does each session last? And how often does a person like myself, anybody who has this issue, how often do they need to come in for the initial treatment and then thereafter anytime for maintenance?
Yeah, so you come in and we do a 28-minute session, and you do 6 to 8 sessions. That's what the research is showing to actually improve and eliminate urinary incontinence. And then I do recommend doing maintenance because it is a muscle. So you want to keep it toned. So coming in every 2 to 3 months for a maintenance session will keep it strong and keep the results as good as when you did the 6 to 8 sessions.
Okay, and then you had mentioned before that it can take about 6 to 8 sessions. You'd mentioned that it's like about most places about $200 for one of those sessions. You kind of think about the investment. Do you have any at your office? Do you offer any package deals or financing options or anything at all that can help people be able to do a complete course or even to maintain in a way that is cost effective for them?
Yeah, so if patients come in and they want to pay for all the treatments up front, you're going to get a 10% discount on your treatments. Also, we like to make things very reasonable and keep a good maintenance of the procedure. So I do memberships with Emsella. So you could do a membership that only costs you $49 a month, and you could do up to 2 sessions per month with this membership too. So you can really keep it maintained really well with this membership protocol that we put together.
Now, I know that you had mentioned a little bit earlier about, the average treatments, but how long do results usually last before someone actually needs to go on a maintenance plan?
So yeah, in the research that we're seeing is it lasts at least 3 to 4 months, and then the muscle starts to weaken and your symptoms will start to come back. So definitely recommend probably doing, like I said, doing a session at least every 2 or 3 months to maintain it. Now, are there people that could go a lot longer? For sure. This is just averages, right? So there's people that go 6 to 8 months and some people that never come in again from doing it. But just averages, I do recommend doing the maintenance every 3 or 4 months.
I think that makes sense. It's like, just going to the gym, right? If I have like a goal that I'm looking for with like a particular weight loss or a weight gain that I'm looking for with muscles, I'm going to need to do a whole bunch of sessions at first to reach that goal. And then if I want to keep it going, I do need to go and maintain. It is a muscle. So that makes sense. And I think it seems pretty reasonable. You do a bunch for that first couple of months, and then every couple months you come in, you do one session, just strengthen up. It's 28 minutes, and you get to read a book, and then you keep it going. And and I imagine you can keep going as long as you need. Over the course of your life, slow down if you need to, test it out. Hey, how did I do? I've been doing this maintenance for a while. Can I take a little break? And just to see how your body responds, because everybody's bodies are different. So, Dr.
Mhm.
Jake, thank you so much for your expertise today. For anybody who's listening and is sold like me and wanting to do this Emsella treatment, you can get a hold of Dr. Jake and be able to book that appointment by calling their number at 801-938-7965. We're also going to put the link in the description box or in the show notes for you to be able to schedule that $49 initial session to see if it feels comfortable for you, see if the process was nice, and if that's something that you want to actually jump into. So that you can, live that lifestyle that you want to live and not have to race to the restroom all the time, like so many women that I know. Thank you again so much, Dr. Jake.
Yes, if you want to learn more about Emsella for urinary incontinence or erectile dysfunction, and you're watching YouTube, click the video to the right. I'm Dr. Jake, and I'll see you there.